the housing and shelter in the isolation and recovery hotels, which is actually Lori Steer, myself, and Ahmed. Lori, I don't recognize all of these phone numbers, and I'm wondering if maybe you are on the call and I just don't see you. I think she had told us she was on vacation, but I was just double checking to make sure that you're not here. Okay. So Ahmed, do you want to start with giving a little update on where we're at?
Sure. So this evaluation really is looking at the COVID-19 isolation hotels. They go by, people talk about them in different names, but essentially there were two kinds of services that were set up for people who were homeless. One was specifically for people who were diagnosed with COVID or were diagnosed or were in need of isolation, so that they had been exposed to COVID or were thought to have been exposed to COVID, and so they needed to be in an environment where they weren't around other people. And then there were other hotels that were set up when some of the shelters closed, but we're focusing we're focusing exclusively in this evaluation on the isolation hotels. And those really were the hotels. There was one in Scarborough, there was one in Etobicoke, and then there was eventually one downtown as well. And there was a lot of discussion at some point about setting up a facility at the Better Living Center at the CNE, and that eventually didn't happen, and the downtown hotel happened after that. That process, occurred over the early days of the pandemic and involved many different organizations, including a number of community agents, many of whom are partners with us on the Marco study. It also, the city was very involved in that. The University Health Network eventually came on as a partner as well. And Toronto Public Health was integrally involved in that as well. What we would like to do in this evaluation really is to look at the structure of how those hotels came to be, and the decision making and the models that were used to try and see what we can learn about how all of those steps happened in sequence for those facilities to be established. So we're not so much focusing in this evaluation on the services that were delivered in the hotels. We're much more focused on the model of care that was being proposed, and we're particularly interested in when and how community agencies were brought into that decision-making process, and how that changed some of the way that those services were structured and were delivered. So really focusing on things like the structure, on the decision-making, and on the partners that were involved. We are hoping that this will have a lot of relevance going forward. So the hotels have either closed or have changed into different, having a different mandate. But if there is a second wave of COVID in the fall or the winter, there will be a need for a very rapid implementation of a very similar process. And so we're hoping that we can learn from the first process, and that our evaluation will really help to inform how that the second process can come to be. So we've had we have quite actually a really great team, lots of representation from many of the different partners that were involved in implementing the hotel program. And we also have some interest expressed from people in the city, both on the political side and on the service delivery side, and promises of that people will speak to us and be quite open and frank with us about some of those challenges. So we're really hoping that this will be a thorough and thoughtful look at some of those aspects of the evaluation. Um, so and we were really hoping to speak, as I said, to many of the people that were involved in the decision-making process, but also to many of the peer workers that were involved in delivering the services, the managers, some of the individuals, and some of the clients as well. Important to recognize that the people that were housed in those hotels include all people who were homeless, including people who come from refugee shelters, as well as people who were staying at some of the larger homeless shelters. So that's an important consideration for our evaluation as well. So maybe I'll stop there and just say that as said, we are. I think we have a great team, but we would really welcome additional people if they're interested in being involved in the team. Kimya is also the coordinator for our evaluations. So if you are interested, please feel free to contact any of us or drop him an email, or you can contact me or contact Michelle or Laurie directly. And Laurie Steer, I don't know if people know her. She's a manager with the neighborhood group, which used to be known as St. Stephen's House, but I think St. Stephen's merged with another agency and now is known as the neighborhood group, and they do a lot of really great work. And we've worked very closely with Laurie. Michelle and I have in a previous project looking at homelessness and mortality. So we're really excited to continue to work with her on this.